Hello, and welcome to today's episode of Uptime, the podcast from Med Healthcare Business News. We talk to experts about the key issues impacting the medical equipment industry. I'm your host, Keri Stephens. HCB News is free to read, so if you're not already registered, go to .med.com/news and sign up after the podcast. Now, it's my pleasure to introduce Chace Torres, aka the Bearded Biomed and Amy and G Healthcare's BMed of the Year in 2024. For a timely conversation about life and HTM. Chace, thanks for joining me.
Always a pleasure. It's been a while.
I want to get into the awareness issues that HTM has because, it's talked about a lot. People are leaving the field, but we don't have the steady talent, the steady, stream of talent to replace them. Can you talk about that?
I think there's multiple reasons for that. One of them being, awareness is always going to be a factor until we get to that point to where it's something that people just know about before they even get out of high school. Like it's up there with the other professions, but we are making strides to resolve that. Some of the other parts of it, why I think we're struggling to hold on to people and keep them from leaving the field are unfortunately this isn't across the field, but there are some bad situations that technicians can find themselves in, and it can be poor management. It can be systems in place, whether a hospital system or company or manufacturer, that are not giving them the tools to succeed, literal tools, or it can be, training. It can be mentorship. There is instances in the field where that it's not a safe situation for everybody. That also placates a responsibility on us in leadership positions to really take hold and, put the effort in with mentorship. There's a difference between managers and leaders. Managers just oversee and make sure the work gets done. Leaders get in there with the people you're overseeing and not only making sure the work gets done, but also motivating them, showing them, imparting little bit more of yourself than you have to on a day-to-day. Like you have to really show these folks that you're invested in them and that they can be more successful than you were in their position. The more we get leaders on board with doing that, I think we'll have less and less people wanting to just exit the field.
Yeah, that definitely makes sense. I want to switch gears a little bit. You started a CEU program for biomeds. Can you talk about that?
Yeah, I decided to just put more on my plate. And last year, actually during HTM week, announced it with Amy. It's a joint partnership to where we just wanted to make accessibility more accessible. So you can get CEU credits through Amy on demand webinars that they have on their site. You can obviously go to conferences like the Amy Exchange, MD Expo, all the other ones, and just sit down and watch, presentations be given. You'll get credit for that. But I had the idea of, because I am a proponent of certification, obviously, it's always better to have more than less. And I eventually want to get it to a point to where there is literal technical training that I can present on the LMS that I built. For, obviously people can listen to select episodes of my podcast and get CEUs through Bearded University, but I'm working with certain companies to actually put out first look, maybe some troubleshooting on actual specialty modalities, and just get more of that out there. Because whether people want to admit it or not, there's not a lot of that out there for technicians. The number one thing, like when you go to HTMA meetup events, conferences, they always want technical training. And, we see the same thing. We see ultrasound, we see contrast injectors, and then maybe an occasional other device here and there. But outside of that, there's not a lot of let's open this up, look at it, see what are some common failures that you can keep. Like, that's the stuff that young technicians want to see. And personally, when I'm watching videos or going to conferences and sitting down to maintain my CBET, my CHTM, I want to get value out of it. There is value, obviously, talking about how to, be a better leader, how to, uh, you know, AI, cybersecurity, the buzzwords right now for the past year or two. But we need to have more taking things apart, first look, troubleshooting, the stuff that is the meat and potatoes for biomed. So that's what I'm actively working towards right now. I just have the podcast episodes laid out on the university LMS, but my end goal is to eventually turn that into just literal. It is a one-stop shop for you to at least get some kind of eyes on different kind of specialty modalities.
Cool. Okay, so what would you say, for students or early stage career biomeds listening? Like, what skills matter most right now? And like, why aren't they, but they're not always taught in school?
So I think a lot of the core biomed skills are being taught, and at least a lot of the programs I've hired from. I mean, obviously, I can't speak cross country. I can only speak from my experience in Texas, but they're they're starting to become more conversation of how can we embed communication, um, navigating, like how to interact with nurse staff, possibly navigating healthcare politics, um, things that are not necessarily technical skills, but interpersonal skills, things that you need as a biomed to be
Yes.
successful.
Yeah.
I have seen some implementation of that in several programs, um, but across the board, there is a gap between those before me in my current position and those that are now coming into the field of their level in expertise and communicating and basically being able to walk into a situation, navigate all the different personalities in a group that you have to appease, take the information that you need to, and then garner that into a solution that is palpable for all parties. And then obviously drive the solution with your technical expertise and then follow it up with this is where we're at, this is what we did, this is what you need to keep an eye out for. Kind of, you know, I always go back to who, what, when, where, why. We, besides doing that on a work order, which is just as critical in our profession, you also need to be able to do that within speaking to people on a day to day basis. That's what makes a biomed very successful.
I've been in this field adjacently for probably 15 years, and I've noticed that I've seen so much more talk about the interpersonal skills in the industry. Before it was just straight technical, but I think that's good because, I mean, to work in a healthcare industry, you're working with lots of people, even though the biomeds might not be encountering patients every day. They're encountering the other clinical staff, so I think that's so important.
Um, if I had to pin anything else, I wouldn't necessarily, since we're giving advice to younger techs, the number one advice I always give folks is maximize your leverage. And that can be in different ways. But I think a lot of people that are getting into this field just automatically expect to just shoot up the ranks. Not all of them, but I have seen that or heard examples of that across the industry over the past couple years. So when I say maximize leverage, I mean putting yourself in the best position to not only warrant promotion, raise, training, whatever, but doing the work that would justify that. So I will tell you, most hiring managers I know, even myself, we're more willing to put in effort to support and elevate you if you're willing to put in that support for yourself. Are you, taking on extra assignments? Are you willing to shadow some of your senior techs to learn how to do something? Are you going back to school to possibly get your bachelor's? Are you studying to get your certifications? Yeah, the folks that wait and put that to the side and say, I'll get to it eventually, you'll find yourself 5, 10 years later wishing you had done it earlier. I I speak to that as an example. I didn't I didn't get my CBET until after I had gotten my CHTM because at the time I felt like, I needed to get that first, but I should have gotten the CBET years and years before I actually did. Um, which that's a whole nother conversation of when should you get it, when it works for everybody. But me personally, I wish I had done things sooner. Right now, when I decided to stop with school, I had gotten my bachelor's. I had all the prerequisites I needed to get promoted years ago. Now I find myself, if I want to be in a position where people actually want to give me the opportunity to interview, possibly accept a position as a director, I'm going to need an MBA just because a lot of my peers either have them or are on the verge of getting them themselves. So recognize what you need and then knock out those prerequisites before that conversation even comes ahead. And I think a lot of younger techs that take that to heart are going to be in a better position than when I was, or even a lot of us that are currently in this position were.
I like that. Okay. So, other than education, what else advice would you give a younger Chase starting out? What would you tell yourself?
Don't be so hard on yourself. I cannot tell you, and I mean, I'm my biggest critic. I think a lot of biomeds are their biggest critics. We're very interpersonal people. Um, you know, we're we're people during the job time, which not even all of us are. A lot of us will hide in the shop as well, but and then we're keep to ourselves when we're home. But so many of my younger techs that I've trained over the years, they just expect of themselves that they need to have the answer and the solution and the knowledge to be able to navigate troubleshooting everything. And that's part of the crux of our profession is there is a a technical gap partially because a lot of it is experience based. It's gaining the wisdom. You work on a particular device and it takes you several hours to finally figure out what the problem is, or maybe have to elicit help from another senior technician to solve it. But once you see that issue, the next time it comes across, you've already experienced it, so you know it. I tell my techs all the time, it's okay to fail. It's okay not to know the answer. It's the willingness to be able to go and tackle the answer. And a lot of what I experienced as a younger tech is I didn't have that necessary guidance of it's okay to not have the answer right away because also military, it's very high tempo, upbeat. Like we need to get this stuff going and, don't dawdle on things. But a lot of you techs that possibly may be watching, listening, it's okay to not have the answer to everything right away. You're gonna gain that as you move up and spend more time doing the job. You're gonna see things over and over and over again to where you're gonna be able to know what the issue is just by an error code or just by how somebody describes a certain problem. But you can't know that all up front. You're gonna gain this over the years of doing the job.
That's great advice. So, I ask every guest this question. I feel like with you and it might be a longer conversation, but what in the HTM industry is keeping you up at night right now? It could be a few things.
Um, I'm pretty at peace with myself, but besides my son keep me up at night.
Yeah.
That we're not solving the issues as soon as we need to. Um, we've made a lot of strides, at least over the past 5 years that well, it'll be 5 years of me doing the podcast later this year. But um, the all these new things that I've tacked on to myself over the years, like with the foundation and everything. That's because I don't see in a solve or an answer to what we have in place. We now have it in place to where at least we have multiple people that have taken on the mantle of being social media influence awareness builders alongside the entities that we've had forever. The different publications, .med, Amy, Technician, all the different ones. And now that we have that system in place where the outreach is there, I've branched into doing TikTok. And what's funny is I've done TikTok in less than half the time of YouTube, and I already got more followers on there than or almost have as many followers on YouTube than I had. Yeah. So while we have these systems in place with all of our different outreach systems, now that we've told them what this career is, how do we get them the next step? We could tell them how great this field is all day, but if they have financial constraints, they don't know where to go. There's a slew of issues that, I look back to where I was, it either you don't have a clear direction or you don't have the family, the financial support, or even the guidance to realize what you want to do. So partially with how I'm addressing what's keeping me up at night, because I don't complain about something without at least working towards a solution. With Ohm's Law Foundation, we're going to turn that upside down to where we're telling people about the field and they're like, hey, if you're serious about pursuing this, we got you financially. And then it's your responsibility to basically do the work and get you through the rest of it. But that's the next step for me. We tell them about it, we support them through it. And then the third leg of that is, all right, you're full-fledged, you're official. Let's take you in apprenticeship, internship programs, work placement, uh, mentorship. Like there's three legs of this journey to solve the major issue that we constantly talk about, that I'm even talking about more ever since I've taken on the nonprofit. But I want to get to a point to where I don't have to have that discussion anymore, to where it's almost irrelevant to even bring up. Hopefully within my career lifetime, that will happen. I do see its possibility because there's so much untapped support out there for us that we have not effectively used. For instance, in less than 6 months, we have 10 foundation partners. We raised $25,000 for scholarships. And me and a team of other people that I'm working alongside are going to begin putting work towards a proposal for grants. There are grants out there for 100,000, 1 million, 30 million over a 5-year span. Imagine what we could do with that. It would literally change the industry. And it's simply by saying, what we're not doing is enough. This is what we can do to address it. And then getting people on board to see the vision and fixing that issue. So while it is technically keeping me up at night, the goal is to basically put it to bed forever.
To do something about it.
Yes.
That's the best way to end this. Chace, thank you so much. As always, it's a pleasure talking to you. And to our audience members, be on the lookout for the next episode of Uptime. Take care.